Treatment of melasma remains more of an art than a science, and with very little consensus in the literature to guide doctors on how to treat this condition. Hydroquinone has been the mainstay of treatment, but there are side effects to consider. And now there are some promising treatments coming out that offer some hope to these patients. Here to talk about that is Dr. Amit Pandya of the University of Texas Southwestern Medical Center in Dallas.
Diavik Acid is a new product that has been published in one publication in which it showed equivalency to hydroquinone. The patients did have improvement in their melasma. However, 30% of the patients had acne-type lesions because of the diavik acid compared to using hydroquinone. So it does show some promise, and we'll see if it compares favorably to hydroquinone as more studies are done. I believe that oral antioxidants are important to combat the effect of the sun on the skin. We know that antioxidants can be helpful to keep skin from developing premalignant lesions. However, we're not so sure about melasma. It is thought that melasma is induced by sun exposure, and that if the sun exposure causes certain mechanisms to come into play that involve antioxidants, it makes sense that antioxidants should be used, and therefore they have been added to many creams. Now we are studying oral antioxidants in patients with melasma to see if there's going to be any benefit. So we'll see what those results are. Sunscreen use has turned out to be even more important than we thought before. There is evidence now that shows that melanocytes can be stimulated by UVA, UVB, and now we know that even visible light can cause darkening of the skin. Well, that's not good news because our sunscreens that we have are really for UVA and UVB. So what I am counseling patients to do is to try to avoid light as much as possible. Even when they're indoors, they should try to wear sunscreen. They should try to have shades over the windows. They should try to turn out the lights as much as they can so that they can avoid even visible light. I think that melasma is a very difficult problem to treat. It is chronic in many patients. And new tyrosinase inhibitors are being developed, so I think there's great hope in the future.
With Skin and Allergy News Digital Network, this has been Damian McNamara at the American Academy of Dermatology annual meeting in New Orleans.